medical moment. We're going to talk. We had a pooch come in this week who was feeling poorly and not wanting to eat. On his physical exam, he had a fever, a low-grade fever of 102.8, and otherwise, his physical was pretty normal. He was mildly pale. He has a quiet heart murmur, but that's not new. And so, since he wasn't giving us much clues about why he felt poorly, we ran some lab work. We did some testing on him. The thing that stood out on his blood work was that his platelet count, which should be 160 to 400,000 ballpark, was 10,000. And platelets are the small fragments in the bloodstream that allow you to form blood clots, which means this dog was at risk for bleeding spontaneously because he had such low platelets. So the obvious question is, why would he have low platelets? Sometimes dogs have low platelets because they're not producing them, but more often it's because they are destroying them. And sometimes they destroy their platelets because they have an infectious disease that makes the platelets look funny to the immune system. We screened him for those infectious diseases. Those tests came back negative. We also are treating him with the medication that treats those common parasitic transmitted diseases just in case. The second reason, or another reason for dogs to destroy their own platelets, would be recent vaccination, stimulation of the immune system. He didn't have a recent vaccination. Certain medications are known to mark platelets and make them look funny to the immune system. He wasn't taking any of those medications. In fact, he wasn't taking any medications. And then sometimes it is cancer. Cancer can be in the body, and the immune system in response to the cancer beats up platelets. And then, just to make things frustrating, sometimes you look for all of those different things and you can't find the cause, and so it's called autoimmune, idiopathic thrombocytopenia, which means low platelets, meaning the immune system is beating them up and we don't know why. It turns out that the treatment for an overactive immune system beating up your platelets is cortisone or prednisone, essentially to suppress the immune system. So while we were treating him for the potential infectious agents before we got our blood test results back, we treated him with cortisone. And the result was, within 12 hours, his fever broke, he felt better, and his platelets went up. It still leaves the question, why did this happen? And so to pursue that, we went on a cancer search. X-rays, we found no cancer in his lungs. On ultrasound, there were some changes to his liver, and what wasn't clear is, were those changes to the liver actually cancer inside the liver, or was it instead just that the liver was reacting to the fact that he had low platelets and was cranking out extra cells? So, knowing that his platelets had rebounded and that he was able to clot blood, we went ahead and did a needle aspirate of his liver. We did that yesterday. We don't have the results back yet. But he's at home feeling much better. If this was just an autoimmune condition, then we've cured him. And all we'll be doing is tapering him off of his cortisone over several months. But of course, there's the possibility that he has additional disease, and we'll have a better idea when we get the cytology results back. That's the scoop. So far, so good.